Hello, everyone. My name is Aya Fujimura-Fanselow, and I'm the Senior Lecturing Fellow and Supervising Attorney in the Duke Law International Human Rights Clinic. It is my great pleasure to welcome everyone to our third event in our virtual event series, COVID-19, Advancing Rights and Justice During a Pandemic. The series is co-convened by 4 institutions: the Columbia Law School Human Rights Institute, Duke Law School's International Human Rights Clinic, Columbia Law School's Center for Gender and Sexuality Law, and Just Security. The title of today's event is COVID-19's Impact on Health, Housing, Water, and Sanitation, Socioeconomic Rights in Crisis. In addressing this topic, our speakers will discuss the ways in which the current pandemic shines a light on and furthers existing socioeconomic inequalities. These inequalities are the result of years of neoliberal policies and the failure of governments to invest in social infrastructure. As a result of these policies and failures, the human rights to adequate housing, to health, and to water and sanitation, among a range of many other economic, social, and cultural rights, are at grave risk for millions of people globally. We look forward to learning more about these issues from our speakers, and we also look forward to their insights about how a human rights-based approach can impact our response, both to the pandemic in the current moment and beyond. To guide us through these questions, it is my pleasure and honor to introduce, in the order in which they will be speaking, first, Leilani Farha. Leilani is the United Nations Special Rapporteur on the right to adequate housing, and also the Global Director of the SHIFT, an international movement to secure the right to housing, as well as the Executive Director of Canada Without Poverty. Next, we will have Catherine Flowers, a community advocate and the founder and director of the Center for Rural Enterprise and Environmental Justice, a nationwide organization based in Montgomery, Alabama. And finally, we'll hear from Gregg Gonsalves, assistant professor in epidemiology of microbial diseases, as well as associate professor of law and research scholar at Yale Law School. Gregg is also co-director of both the Yale Law School and School of Public Health Global Health Justice Partnership, and the Yale Law School School of Public Health and Medical School Collaboration for Research Integrity and Transparency. Today's format will be as follows. Each speaker will have about 10 minutes to speak. Following that, we will have a moderated question and answer session based on questions from all of you who are joining us today. There are 2 ways to submit your questions to the speakers. First, you can use the Q&A function on Zoom, which you should see at the bottom of your screen, to ask questions. You also can tweet your questions using the hashtag COVID-19Justice, and that's COVID-19Justice. And we will do our best to get to as many questions as possible. With that, I hand it over to Leilani Farha. Thank you all.
Thanks so much, Aya, and thanks to the organizers for making this happen. It's definitely not like presenting in real time, face-to-face, but it's so important. And it's so important because I don't think we can do anything but stop talking, exchanging ideas, and really looking at the human rights issues at play here and trying to move those forward. I just want to start by saying the obvious, at least obvious to me, and I think my co-presenters. The pandemic has exposed for all of us the fissures in society, the gross inequalities. It has exposed it to us, I think, in an unprecedented way. Everyone's talking about this as an unprecedented situation, that the virus is unprecedented. I think the exposure of these inequalities and human rights violations prior to the pandemic is unprecedented. I'm going to talk to you about the right to housing. And, I've been the rapporteur for 6 years. I've been working in this area for 20 years. Always arguing that housing is a human right and what that means. I think the pandemic exposes to us exactly why it's so important to understand housing as a human right, and I'm going to take you through that, I hope. I think you've all realized by now that over 1 billion people worldwide are subject to a single policy with respect to the pandemic, and that single policy that is, really across the board is that we must all stay at home. in order to flatten the pandemic curve and decrease the amount of infections and the rate of infections. So obviously housing and home has become central to addressing the pandemic. But of course, home means such a different thing to different populations. I'm going to take you through some of those populations and how they're faring and how a stay-at-home policy may or may not work in their context and what the solution is in that regard. So if you take a stay-at-home policy, obviously the people who this really doesn't work for are people who are homeless or houseless, as they say in some circles. Obviously, if you're living on the streets, you can't stay home because you have no home in which to stay. But even further than that, there are issues around shelters. If you're already living in a shelter, shelters are not safe spaces from the pandemic. They are incubators of infection. And you have to remember, people living in homelessness mostly have respiratory issues and underlying health conditions that can really make them vulnerable to this particular virus. We also are seeing homeless people being warehoused. We're seeing shelters close down because the shelter workers don't have PPEs or personal protection equipment, and therefore they have to shut down the shelters, and then homeless people are having nowhere to go. What's so interesting about this case and all the others that I'll reference is that the solution is a human rights-based solution, which is, in this case, all homeless people have to be housed. It's simple. And they have to be housed appropriately. We could see a global end to homelessness, actually, in the face of this pandemic. Homeless people need to be put in hotels if those are available, or any vacant units. Army barracks are being used. There's all sorts of things. I've heard of camps being used. All sorts of possibilities are there. Another group that are disproportionately affected are people living in informal settlements, for example, in the global south, but also tent encampments or encampments in the global north. Again, lack of access to water and sanitation. And I think my co-presenter, Catherine, is going to speak about water and sanitation in the rural context. Well, water and sanitation in the informal settlement context is obviously a huge issue. And then, so people can't wash their hands. And when they're staying home, there's issues of overcrowding. These things can be resolved. Water and sanitation issue can be resolved, and is in fact part of what is required under the right to adequate housing, is that people have access to adequate water and sanitation. I'm also concerned about what's happening for renters across the world. I'm seeing very little protection for renters, and we all know that people who are employed who were employed before the pandemic are increasingly becoming unemployed or underemployed, making it really difficult to pay the rent. And, rents are exorbitant in cities around the world. This is a global phenomenon. And part of that is related to the whole housing system that we've created that has enabled big private capital actors, corporations, institutional actors to come into the housing sector and inflate and escalate rents. And so renters are really struggling. Well, affordability is one of the key components of the right to adequate housing. And so governments are now having to figure out what are they going to do about people unable to pay their rent? And all sorts of new affordability measures are coming into place and into play. People who actually have mortgages, who are homeowners, are also really suffering because, again, often mortgage payments were, people are living so close to the edge in such precarity. They're having to, live month to month, paycheck to paycheck. And in the face of this pandemic, that's no longer possible because there is no paycheck, and government subsidies being provided may not be adequate for people to meet their mortgage payments. So what are we seeing? We're seeing governments move in and do new acts like mortgage deferrals or mortgage forgiveness in some cases. I think my time is going to come to a close soon. So I just want to say, it's so obvious. I think so many people are talking about this, but it's important for us to have this conversation. And that is that this is an incredible moment, because while a lot of people are suffering and suffering more than we would like, there is an incredible opportunity. I am seeing across the world things happen that honestly 6 weeks ago we thought was impossible. For example, I just had a call with someone from Belfast, and she was telling me that all street homeless people are now housed in hotels with services, with adequate services. I've heard similar things coming out of California. I mean, the hotbed of homelessness in the US, where finally mayors are getting on board and saying, oh, we have all these empty hotel rooms. We could use these to actually serve a social good and a social purpose. I'm hearing in Cape Town, South Africa, of new human rights monitoring in local communities and informal settlements to make sure that people's human rights are being protected during this pandemic. So much activity and so much possibility. Governments around the world saying that there shall be no more evictions during the pandemic. As I already said, mortgage forbearance and mortgage deferrals. These are all things that were not really on the table 6 weeks ago in so many countries. The question is, how do we make sure there isn't retrogression after the pandemic? And that's one of the things that I love about the human rights framework, and I'm going to end here. Because under international human rights law, retrogressive actions are in fact a violation of human rights. So if you house homeless people in hotels, it would be retrogressive at the end of the pandemic to put those people back on the street. And so we have that human rights tool here that we can use and deploy, I hope, going forward. Thank you.
Thank you so much, Leilani. Catherine?
Yes, I like to speak more from a rural perspective. I live in Montgomery, Alabama, and most of my work has been in Lowndes County, Alabama, which is located between Selma and Montgomery. But our work has expanded to go across the United States in communities that are rural and have never had access to adequate water and sanitation. And in particular, have not had access to the infrastructure to provide them with sanitation. In my involvement, we had an opportunity to do a study with the National School of Tropical Medicine at Baylor College of Medicine, where we found evidence of hookworm and other tropical parasites in Lowndes County. And the first indication that we got from the health department in terms of how to deal with it was to deny that it was a problem. And what we found with the coronavirus is that on the federal level, initially the response was to deny that it was a problem. And I think that what we had seen early on was that there was something missing in our public health system, and that we were not prepared to deal with things that we know could potentially be a problem. And when it came to the surface, the initial response is to deny instead of to respond and try to address it. So in our work, we've gone across the US. One of the places that we went to that I'd like to mention is an area outside of St. Louis that is called Centerville. And when I went to visit Centerville, what I saw there were a lot of retirees who had bought their homes, and now their homes had lost value. And when they flushed the toilets, it goes out onto the ground. And actually, I saw more toilet paper there from flushed toilets than I saw in Lowndes County, Alabama. And this is a problem throughout the US, and we've been contacted by places from around the country that have asked us to go and visit. And the reason this is important in the age of the coronavirus is because there have been at least 2 studies that have shown that the coronavirus can live in feces. And if that's the case, then people that are living in these areas that are already vulnerable are going to become even more vulnerable. What we're also seeing that's playing out now is healthcare disparities. In areas like Louisiana, which is becoming a hotspot, and a lot of people are dying there. But that's also where you would find Cancer Alley. And Cancer Alley is a place where, for those that don't know what Cancer Alley is, it's a place between Baton Rouge and New Orleans, where all of these petrochemical plants are located. And a lot of people that are in those areas talk about respiratory issues. And a lot of what is happening there is not only going into the air, but also going into the water. We talk about what's happening in Detroit. You know, there you have a lot of massive water shutoffs. When people don't have water, they don't have sanitation either. So they can't not only wash their hands, but what are they doing when they go to the bathroom as well? And as the previous presenter talked about homelessness, same thing. You know, I had the opportunity to visit Los Angeles, and I was in an area where there was a great deal of homelessness. And what really still bothers me, and I still have sleepless nights about it, is how people were stepping over people on the street. And it was almost as if they had no souls, they didn't see them. And we have to deal with the inequalities that have been exposed as a result of the coronavirus. Although I'm supposed to be talking about water and sanitation, but we also have to talk about what I see here in the South, where I live, as I mentioned before, in Alabama, where we just had a shelter in place order. It took forever for it to happen. But there are a lot of people that still have to go to work. You know, we have a lot of people on the front lines, and I'm not talking about the essential workers that generally the healthcare workers and so forth. I'm talking about a lot of people that are delivering groceries. I'm talking about people that are not even making a living wage, and they're being forced to be out there. And some people don't have insurance. And I believe that what we're going to see across the board is all of these healthcare disparities play out in such a way where we're going to have higher numbers of deaths among people coming from vulnerable populations. So I'm very, very concerned that this is an opportunity that we need to take to deal with these inequalities that have existed in this country. And we need to, and across the globe, to talking about putting in place safety nets where people have a human right to water and sanitation. People should have a right to health care, you know, especially at a time like this. When I wonder if a person goes to the hospital with the coronavirus and they don't have insurance, whether or not they would be turned away, but they receive the same type of treatment that a congressperson would receive if they went to the hospital. And and I think the human rights framework would be a way in which to address all of this, to make sure that if there's another pandemic, once this one is over, will we still have the same problems, the same type of inequities that exist that that puts people in positions where they're very vulnerable to these type of diseases.
Great, thank you, Catherine. Greg.
Hi, everybody. So I'm going to talk on health, but this is a pandemic, so it's about everything. So, you know, any of us who watched the U.S. response over the past few weeks and months realize it's been bumbling and chaotic. And the U.S. now has the worst COVID-19 epidemic across the globe. And, you know, there's a temptation to sort of lay that blame on President Trump, and I think we can. He dragged his feet from day one during the pandemic, starting in January. But the features that make the epidemic so disruptive and terrible in the United States have much longer and deeper roots in our political and social order in the United States. And I think you could say around the world, sort of a cult of neoliberal austerity, whether it's been in the context of foreign aid or in the rollbacks of the NHS in Great Britain, what happened to Greece during the 2008 financial crisis, we've made a sort of wholesale disinvestment in many of the things that now we're calling on to keep us safe, you know, and this sort of systematic disinvestment in public health and the social safety net that Catherine is talking about have enhanced the vulnerability of Americans. And we've created a system where there are people who can get care if they're a member of Congress, if there's somebody who works for a university like me, or they have health insurance to their employer. But there's a whole group of people outside of the circle of care in the United States. The homeless, as Leilani talked about, the undocumented in the United States who may not have access to Medicaid, the people who use drugs, and the incarcerated in the U.S. are also at special vulnerability to COVID-19. And they're outside of our circle of care in the United States, along with the over 20 million people who are still uninsured post-Affordable Care Act. My friend Amy Kepchinsky and I wrote 2 pieces in the Boston Review over the past couple of weeks, one called Alone Against the Virus and one called Market versus Live, where we're still pitting we see debates in the US pitting the return to normalcy and the need to rescue the economy as opposed to the need to rescue and save lives. And we think that's a false dichotomy. As many economists we've spoken to have been saying, the first rule of virus economics is to stop the virus. So I want to talk about a couple of things that we can all do together, because I think this is this pandemic cries out for activism first and foremost. If we leave this in the hands of our leaders, whether we're in the United States or in Great Britain or in Nigeria, we're lost. And a couple of things I want to bring up in the context of the US pandemic, because I know it best, is one is we need to devote funding to this epidemic. And we're not talking about $850 billion to corporations to keep them afloat. You know, there was $150 billion for state and local governments in the past emergency bill. Guess what? That doesn't even make up for the lost tax revenue and commercial revenue that these states are going to suffer. So basically, the states and localities across the U.S. are left to their own devices to fight this pandemic. And to get us out into the next phase where we could think about returning to work or returning to school, we're going to need a massive infusion of resources at the state and local level, reaching out into rural communities that Catherine's talking about, but also the small towns and cities across the US, as well as New York, San Francisco, Los Angeles, and these major metropolitan areas. We're going to need to scale up testing for COVID-19, both for the presence of the virus and antibodies, in a way that really dwarfs any public health endeavor we've tried in the US in recent memory. This means we're going to need to produce millions and millions, hundreds of millions of tests, all the reagents and supplies we need, and we're also going to have to create a public health corps of people who can go out and do this testing. Many people unemployed right now, which could find employment in this new sort of cadre of community health workers who can help us move into the next phase of this pandemic, where we can start to get on the road back to normal, if that's even possible. The other thing is, you know, we keep talking about the lack of personal protective equipment in the US. In most hospitals, people are reusing masks. They may not have enough PPE to go around for nurses and doctors on the front lines of the epidemic. People in grocery stores who are seeing people on a regular basis, as Catherine mentioned, our first responders, police, fire, and EMS, don't have enough PPEs. We're going to need to figure out how we can scale up these commodities that are essential to the public health response. I think there are a couple of other things to talk about here. One is we need coherent, unified leadership in this crisis. The US has 50 states that run their public health efforts on 50 different plans and 50 different sort of styles of leadership. But we need a coherent set of coherent leadership in the US that doesn't, that tells us whether Jared Kushner's in charge or Mike Pence and the task force is in charge. Right now we have a president who's railing about quack cures like hydrochloroquine because he thinks it works, while medical professionals are saying, wait, hold a second, we don't need to make people rush to pharmacies and to try to get drugs that are useful for other conditions, which is now in short supply. So we need evidence-based comprehensive leadership from the federal level. And this is both from the White House, but also from the Congress. There's going to need to be another stimulus or emergency bill, which is going to send money down to the states and local areas to scale up the testing that we need to get into this next phase of the epidemic. And finally, there's other thing I wanted to bring up. I said people are outside of our circle of care in the US, whether it's the homeless, people who use drugs, sex workers, undocumented people. They're outside of our circle of care, and they're also unable to social distance. If we're going to try to bend the curve, and we can't just bend the curve in New York City or in New Haven, Connecticut, we need to bend it in all 50 states and across all 50 states to vanquish this virus. We're going to have to give people the resources they need so they can stay at home. So it means subsidizing income for people, not with an unemployment check or a one-time gift of $1,200 from the federal government, but real income support so that people can, whether were employed before the outbreak or they're recently unemployed, can survive over the next 3 to 4 months and put food on the table and not make choices that endanger their lives and the lives of their communities. We're going to have to clear the prisons, right? There's no way to do infection control in prisons in the US. We know from TB and other infectious diseases that prisons push people into the path of epidemics. So some public health people and some corrections people have been calling in unison to reduce the occupancy of state prisons and jails across the US, but this also goes for ICE detention facilities, where children and their families are held in detention in unsanitary conditions which cannot protect them. And second, I just want to turn back to the issue of the homeless. If you do not have a home, you cannot shelter in place. In New Haven, some of the homeless are being sheltered in hotels in the city, but you know, often it's under the supervision of the police and makes these places de facto jails for people in my town and across the country. So I think we have to figure out ways to give people the support they need to do their social distancing, to withstand the sort of crushing economic effects of this pandemic. And I think this is going to need leadership, both at local, state, and federal levels. Catherine was saying, you know, one of the last states that sort of put in shelter-in-place orders was Alabama. Well, actually, there are probably about 10, 11 states who still refuse to do so. So we're seeing a failure of leadership from the bottom up, from local to state to federal level. And unless we get our act together as advocates for human rights and for people in our communities, we're not going to see an end to this epidemic anytime soon, either in the United States or around the world.
Thank you. Thank you so much to all of you for your really incredible and insightful analyses and the examples that you gave that really helpfully illustrate the ways in which the pandemic has been impacting different economic, social, and cultural rights. We have several questions coming in, and a reminder to all to please submit your questions through Twitter. Again, the hashtag is COVID-19 Justice. That's COVID-19 Justice. So I'll start with a few of the questions that have come in. And a few of you spoke about the importance of, and Greg, you sort of ended on this, the importance of a bottom-up approach and the work of social movements and social mobilization. And so I wonder if you can all say a little bit more about the important role of social movements, as well as people are asking about what regular citizens who are at home can do really concretely to ensure protections for vulnerable people in this pandemic. Leilani?
I didn't know if you were going to, you know, elect one of us to speak or how it was going to go. Yeah, I mean, a bottom-up approach, you know, it's so interesting because there's been such a little amount of a bottom-up approach. I think, one, because of the nature of the pandemic and it affecting like the whole populations. And so governments just swooping in and needing to, in my opinion, declare states of emergency and do a whole bunch of what might be perceived as top-down things. And there's been a kind of, I find for a lot of us, for governments, for just, you know, advocates, et cetera, there's been a kind of deer in headlights moment, right? Like, holy, what do we have here? Getting your head around your own personal safety, the safety of your household, your family, and then realizing, oh my gosh, and I have a really important role as an advocate here, and you know, community-based advocacy. So I think that's been part of the problem. There's a huge role for bottom-up approaches here. Absolutely. I mean, we know that change only really comes about from the bottom to the top. And so if we want to really address this pandemic effectively, we have to be listening to the people who are living this, you know, on the ground, whether it's frontline workers, homeless people, people living in rural contexts without, you know, access to decent water and sanitation. One of the examples I like to give is in informal settlements. I've been saying that they absolutely need access to clean water and soap and disinfectants, et cetera. Well, a government can't swoop in and make that happen. They have to work with local leaders in the informal settlements themselves and get those leaders in informal settlements and the women head of households engaged in this, understanding the virus, figuring out how they as a community can rally and work to protect themselves. It's so, that to me, I like that example because it's so clearly, it's obvious that has to come from the community themselves, especially when there are stay-at-home provisions, when governments can't come in in numbers and do things, and that would be inappropriate anyway.
You know, I just want to mention yesterday, about 40 of us, well, 40 cars drove up to Hartford, Connecticut, to our governor's mansion. We had a social distance, so we stayed in our cars, but we drove around honking our horns for an hour saying, you need to release prisoners from the state jails. We're going to need to get creative. We need to protect ourselves and our communities, but that doesn't mean we just sit back and watch the pandemic roll over us. And the honkathon that we had in Hartford yesterday could be done any place with anybody who has access to a motor vehicle. But there's also old-fashioned letter writing, phone calls, emails to our representatives to know that, you know, people in Alabama care, people in New York care, people in Connecticut care. And where you have representative government, it's time to sort of hold these people's feet to the fire. I don't think we're powerless. We're just going to have to be a little more creative than we've been in recent years.
Mm-hmm. Catherine, would you like to add anything?
Yes, I would. I think that one of the things that I see forgotten in a lot of this is protecting the common good. And I think that when we look at government, I think that's the role of government, to protect the common good. And that hasn't happened. And what we're seeing is a disjointed effort to address the pandemic. And my fear is, especially in those communities that that don't have the resources to do things from the bottom up, that they're going to be the last ones to heal from this.
Great. Thank you all. Another theme that's come up in all three of your talks, and that was also the theme of our last session last week, was the impact of the pandemic on especially vulnerable groups. And there's also a question about how state agencies, service providers, the private sector, and impacted communities can really ensure that the most marginalized and vulnerable groups are protected, including people who face intersecting levels of discrimination. Could you say a little bit more on sort of how we might approach the most vulnerable and most marginalized?
Well, I like to respond to it. I know I've been reading lately about what's happening in Germany and how they address how they're addressing the pandemic. And one of the things that has happened there is that they're doing a lot of testing. A lot of these vulnerable communities don't have access to tests. I mean, there was a case in Michigan where a young man who was, I think, in his 25 years old died and had tried on 3 different occasions to get tested and to get medical care and didn't get it. And what I think is happening in a lot of communities, especially vulnerable communities, is that people are not getting the access to care quickly. And that was before we start reaching this critical mass where there are more and more people that are getting infected. So one of the ways in which vulnerable communities can be helped is to have access to testing and also have access to medical care. If you look at the rural communities, a lot of rural hospitals have closed. So they have nowhere to go locally to get care. They have to drive to the cities that are already overwhelmed. And there needs to be a way to put in place a plan to provide care for people that are in the rural communities, people that are in the vulnerable communities. And looking at the German model, it is theorized that one reason why they haven't had as many deaths is because the care is taking place a lot earlier when people start having symptoms, instead of what happens in a lot of the vulnerable communities. By the time they get care, it's almost time for the person to be admitted to ICU, and that needs to change.
I'll weigh in. And thanks for those comments, Catherine. I completely agree with you. I think there's a couple things. I think that those in decision-making positions need to recognize who their vulnerable populations are. And that from there, that will start flowing different thinking right away. And from there, it might be realized that sometimes universal policies are going to protect vulnerable groups. And sometimes you're going to need very specific policies and programming, et cetera, to protect vulnerable groups. That very rarely will only universal policies protect vulnerable groups. That much we know. But sometimes they will. Like, I've issued a call, no evictions of anyone, anywhere, for any reason, except in the case of criminality, and even then, or violence, even then those people have to be housed. So, right, so that's a universal policy that's going to benefit a lot of different vulnerable groups. But there are other policies like stay at home, which we've already discussed at length, that don't and won't. And so you need to figure that out. And I think our bottom-up conversation was really key here. I mean, we have, let's say with Indigenous communities, an understanding that they have the right to self-determination, right? And that nothing should be done really that will affect them without their free, prior, and informed consent. Those are human rights understandings that states around the world have committed to. And so are Indigenous communities being, for example, engaged in a meaningful conversation about what this pandemic means to their communities? I'm seeing, reports saying that some Indigenous communities might be wiped out completely if the pandemic reaches them. And so, what kind of engagement is happening there? And are they being allowed to lead in addressing the pandemic for their own peoples? And not just lead, are they given the resources to do that, the capacities, et cetera? Not just, oh, go deal with your own community. It can't just be like that, right? Because these are disenfranchised and disadvantaged communities in major ways. And so they need to be fully supported. Those are also human rights principles.
So we're in a special moment right now. We're not going to be the same after this pandemic. The whole planet this is a world historical catastrophic event. And for some communities, it's crisis upon crisis, right? It wasn't good before, and it's not going to be good afterwards, but it's also an opportunity. So there are people out there who think by virtue of their wealth or their status, they don't need to deal with the public health system or the healthcare system because they can buy whatever they need, right? But I think what this pandemic has shown is that unless we deal with the most vulnerable in our society, none of us are going to be safe or free from this virus. So it's in our collective vested interest to sort of lift up the homeless, people who use drugs, the undocumented, to bring them into the circle of care. I keep saying this because the virus doesn't care who you are, how much money you make, where you live. The point is that if we're going to eradicate coronavirus from the US or from different countries around the world, we're going to have to do it everywhere. And people's vulnerabilities make all of us vulnerable. And so maybe we're going to have a little bit of change of heart in a global fashion. There was an editorial in the Financial Times yesterday, which was starting to talk about social programs and social policies that frankly are never on the editorial page of the Financial Times. I think maybe we're seeing a phase shift in global thinking about whether this dog-eat-dog 40 years of Thatcherism and Reaganism sort of run amok, maybe it's come to a deadly end.
So you've all given a couple of examples of the way in which, even though there's been a lack of cohesive leadership, as Greg noted, that local, state, or national governments have taken some temporary measures to address these issues, whether that's been moratoriums on evictions or moratoriums on water shutoffs. And you've also all spoken about how the possibility of using this current moment as an opportunity for a more transformational change. And so can you say a little bit more about the way in which we as advocates and activists can ensure that some of these temporary measures during the pandemic actually build towards more systemic change? And in particular, as Leilani mentioned, the concept of non-retrogression under international human rights law, that states cannot go backwards. And there's been a question specifically on that concept, and how can we ensure that governments respect the obligation to protect these human rights even going forward?
Well, some of the activism that we've been involved with has been around writing editorials even before the pandemic. I've been doing a lot of work with Joanne Ward of the Human Rights Institute at Human Rights Law Center at Columbia University. We have been engaged on numerous levels, including going to Geneva and trying to put forth these efforts and letting people know about what is happening on the ground and what policies potentially need to be changed using the human rights framework but we haven't gotten a lot of traction in getting our local politicians or state politicians or federal politicians engaged. So we've used the human rights framework in that regard. I think that we should also probably look at codifying some of the things that are being done now that we were told just 6 weeks ago could not be done.
Mm-hmm.
So we can look at ways in which going forward, we'll be able to apply this and make this policy. Because until it's made into policy, they're going to change it. And I think that that's one of the things that activists need to be working together on doing right now. Because, I mean, I'll use Bernie Sanders for an example. A lot of things that Bernie Sanders was saying don't sound so far-fetched, you know, when we look at it through the lens of the coronavirus. So as activists, I think we shouldn't wait. We should be engaged right now in terms of what policies and procedures we're going to be using to try to get a lot of this codified, and also making sure that no matter what happens in November, we have to turn out in mass in our own personal protection gear, that we show up at the polls and vote.
You know, the other thing I want to mention, and I get my funding from the NIH, so this isn't a pitch for me, is that private foundations need to support groups like Catherine's in Alabama and other groups working at the rural level, suburban level, working with vulnerable communities, because this is a social mobilization emergency, right? If we don't want retrogression, believe me, your governor, your mayor, your president, particularly in the United States, depending on where you are going to roll back whatever they can, right? They want to go back to normal, and we have to say no. And the only way to do that is getting private foundations to invest in advocacy at the grassroots level. And that means doing it now, and not with sort of project-based support where they can write a report for you or do a workshop. It's giving them core support for 2, 3, 4, 5 years so they can build a community of activists locally, statewide, and then across the country to sort of keep things from going backwards. And if foundations are looking for things to do, they don't have to do a COVID-19 emergency response. They need to invest in activism at the grassroots day and tomorrow and the day after that, so that we can keep people's feet to the fire, because otherwise it all goes away in 18 months to 2 years.
Yeah, and I would add to that, to ensure that it's understood that these movements are actually global. You know, like the pandemic, the reaction from the grassroots is global. It's a global reaction. I am worried, as Gregg articulated, that those in decision-making roles will want to just go back to the status quo. The status quo benefited many of them, and you know, they're in deep with the status quo, let's say. And also from the point of view of international human rights law, what an argument that can be used against non-retrogression, so to say, well, retrogressive measures are okay, are financial arguments. And of course, every government around the world has at their disposal the argument that they are now poor. They are in recession or depression, et cetera. And so we have to figure out ways to counter that argument, to say, well, actually, you know what? In the area of housing, water, sanitation, health, whatever, you're only just making up for the underspending that Gregg talked about through your 40 years of neoliberalism or whatever. And so we're going to have to be very, very clear in our arguments. But I just want to end by picking up Gregg's point, which I think is actually in Catherine's as well. I think we're going to have to start doing things differently, new collaborations between grassroots movements to show that, you know, this is a pandemic that's about everything. Everything is on the table right now. And so those grassroots movements that are working on health issues or Indigenous peoples or homelessness or rent and mortgage arrears or, you know, health related issues, et cetera, we need to somehow form some kind of a collaborative whole to say we have a new vision and we have our own vision for the world and for, you know, I've been calling for an alternative G20 vision, right? Our own G20, but not G20, G100 and however many countries there are in the world, 198, right? To say there is a different vision out there, and people are really feeling that different vision is possible and necessary for the next pandemic, if nothing else. Yeah. It's the time.
Great.
Oh, I would like to quickly add that as we talk about all these issues, we also need to add climate change.
Mm-hmm.
I think climate change kind of undergirds everything that we're dealing with right now. And there are going to be more pandemics if we don't deal with climate change.
Great, and that's a perfect lead in actually to another question, which is that for this panel, we were specific about some of the rights that we asked you to address based on your expertise. But of course, as you've also all alluded to, that a full range of human rights violations that we see in this current moment, including, for example, around the right to employment and education and food. And so there's been a question about, are there running sort of common themes that you might see around different types of, especially economic, social, and cultural rights issues as solutions? So for example, living wage or sick pay that you can point to.
Yeah, I think that if we look at the, one of the things that we can look at is what Reverend William Barber is doing with the New Poor People's Campaign. And there's a platform there. And one of the things that they've been advocating is for a living wage. And I think that I'm seeing examples now of people that are out there on the front lines that are not making a living wage or are not guaranteed that if they put their lives on the line, that they would be taken care of. I've seen people in the local area who can't take off work if they don't have vacation leave, although somebody in the plant could have tested positive for the coronavirus. So we have to, I think that we have examples here in the US that we can look to, and the New Poor People's Campaign as a platform that could be a starting point.
Yeah, so one of the things I'm starting to sense is a real pushback against the continued financialization of housing. So that's where the big financial actors purchase affordable, what they call distressed assets or undervalued assets, and often multiplexes, so like big apartment buildings, multifamily residential. And they purchase those and then they do some modest repairs, cosmetic repairs, and then they try to up the rents, and that results in a huge number of evictions wherever they're doing this, and they're doing this globally. And I'm seeing a lot now starting to, I think the shock of this is sort of a little bit fading, and I'm seeing that more movement around, okay, we cannot allow this crisis to result in what happened in 08 and 09 in the global financial crisis, which is when these actors really got a real foothold in residential real estate globally. And so a kind of, I don't see a policy emerging, but some sense that we have to regulate these financial actors and we have to protect our housing, and that now is in fact a very good time to build public assets, so that when assets are becoming distressed, so apartment buildings the owners are unable to pay the mortgages, so those become distressed assets, getting governments to move in with a right of first refusal and purchase those assets and make them become public and part of our common good and our public assets, civic assets. So a kind of twofold, and I obviously will encourage this going forward. Some of you who are listening in may know I was part of a documentary film called Push that's very much about this, and Push the film was really documenting, of course, pre-pandemic, and came out pre-pandemic, but it's super relevant right now. And so we're going to be using that as a vehicle to really galvanize people around this issue and make sure that we don't allow those big financial actors to prey on residential real estate.
You know, I just want to build on something Catherine said about the poor people's movement and Dr. Barber. He's harkening back to a time before the 1980s when greed became good, and it's pulling us back to an era where social and economic and civil rights were tied together for the advancement of the common good. And we've had flowering of progressivism across the world at different points in history. In the US, it was in the 60s and back in the New Deal. We've just had a bad 50 years of financialization of housing, but also sort of the idea that we can monetize our healthcare system, where we know what something is worth in dollar terms, we don't know if it's fair or good. And so I think we have to get back to basics of a new sort of progressive era in both the U.S. and in global politics, and throw the sort of the sort of neoliberal conservative agenda that sort of impoverished us, not just in economic ways, but socially and spiritually as well for the past 50 years. And we have to throw it to the wayside and let it be one of the victims of the epidemic that we won't really mourn.
And Leilani, you in particular shared a few examples from the Global South in terms of positive ways in which either governments or social movements are responding to the pandemic. And so there's a question about whether there are other examples of the ways in which those in the Global South are responding, and that this also could perhaps be a moment when the Global North looks more actively to the Global South as a real learning opportunity of putting human rights at the center of different efforts to address the pandemic.
Actually, I'm seeing activism everywhere, and I don't think one hemisphere is leading more than another, to be honest. I find it amazing that everyone, I mean, if you look at the movements in the Global North around no evictions and rent strike, or, you know, some kind of a pause on rents, those are very strong movements I'm seeing in Western countries. And northern countries. So I don't really see that kind of divide. I think there's some really interesting activism going on in India around the terrible lockdown that the country was put under with 4 hours notice. You know, they're really using the media to draw attention to the migrant workers who were caught unawares, have no income because everything shut down. And I mean, just you know, Google and you'll see the images of very not COVID friendly environment for that huge, massive population. Some of the NGOs that I work with in India have been working very hard to try to protect homeless people. So there's just a lot of activism going on, a lot of work around informal settlements and getting access to proper water and sanitation. But you know, one of the coolest things I've seen is that in Skid Row, the organization LA Can has worked with the community to develop their own sanitation stations that they're putting all throughout Skid Row, and they're painting them beautifully, and they have these like fancy mechanisms, and there's videos on how to use them and how to properly wash your hands for 20 seconds, and how long is 20 seconds and all of that. And I mean, that is the type of thing, you know, grassroots movements and are used to doing, they're used to stepping in and doing what governments don't. In Nigeria, I've seen these beautiful protective face masks being made by local women who are, you know, making these and trying to distribute them to people in informal settlements as a way of trying to increase protection. So there's a phenomenal array of stuff going on all around the world.
Catherine Ergo, would you like to add anything?
Well, I think that one of the things that is happening is that a lot of people are working together that have not worked together before. And even some foundations that have been doing outreach. I was recently connected with someone who is actually connected to China, who is interested in helping and connecting to local hospitals to make sure that they can get personal protection equipment. That is something that had never happened before. So I think that there are some collaborations that are coming together that we hope will last beyond the pandemic.
Thank you. Greg?
All right, I'm okay with that one.
Okay. So I think we have time for about one more question. And there's been, one of the questions is about how to avoid a redo of the response to the global financial crisis. And if I can add also, particularly thinking about the fact that a financial crisis would of course have disproportionate impacts on the most vulnerable and marginalized that you've all spoken about. And so what are some things that we can think about in terms of responding to that going forward?
So first of all, this isn't the global financial crisis. You know, where massive infusions of funds to prop up the economy was what was needed. We need a planned stoppage, right? And this is qualitatively different than any other sort of bailout that we've seen in the past. And it goes back to the issues we've been talking about. How do you do this safely? You know, in the United States, the last bill put $850 billion in the hands of corporations. Sure, give them money to support their continued viability. Same thing with a slightly smaller amount for small businesses. But there was nothing left on the table for the communities we're talking about, local and rural communities, local small towns and cities, local and state governments, for dealing with all the sort of vulnerabilities we've been talking about today. And so if you don't want it to be a corporate bailout and a corporate giveaway, it needs to go back to the sort of first principles of advocating for what we need. And you know, there's an interesting conversation going on around academic economists who I think are in the same, are on the same wavelength. This is not the housing crash of 2008. This is something very, very different, and it requires a different kind of response. Gabriel Zuckman and Emmanuel Sides at Berkeley have talked about an 80% income subsidy for people, like is being done currently in Denmark, but do it in the US. People have talked about other ways how you support people to get through this, because you want to put them back to work if they've had a job beforehand, and not sort of make this as something that's going to trickle down, which is what we always do.
I guess one thing I've been, I mean, that's a very tough question to answer. I totally agree with what Greg said. This is not 08, 09. It's a totally different place. Some things remain the same. Some people will have money at the end of this, and some people won't. And who those people are, or entities, shall I say, is what's troubling and worrying to me. So, you know, I was on a call last week with some real estate folks in New York, you know, big real estate lawyer and people working in the real estate industry. And, you know, they were saying private equity still has their money, pension funds still have their money, and insurance companies still have their money. Maybe not as much, but they still have a whole heck of a lot of money. And so what we need to make sure, at least in my sector, is that they don't spend that money and use that power and the political power to really undermine the right to housing and just take advantage of the situation, and, you know, act as the vultures that they often are. But one thing that I've been using, a tool to help me think this through, is just to ask myself a simple question. And I've been putting this to governments, local and national level governments, just a very simple question. Who do you want to be the winners at the end of this? Who do you want to, and I keep saying, surely we want our households to come out of this whole, not to have, like, gain. No one's gaining at the household level. Very few people are gaining here, but we want them to come out whole. In other words, not overly indebted, for example, or not indebted at all, with the prospect of a job, if not a job, you know, these sorts of things, with a home intact, without the threat of eviction, without the threat of future eviction because you can't pay your mortgage or whatever. So I think it's a nice, very simple question, you know, and I know who I don't want the winners to be. I don't want the winners to be big capital again, and corporations again, et cetera. And so it just allows for that kind of conversation. And no government is willing to say, oh no, I really want those guys to win. At least they won't say that to me. So it allows for that, a more textured conversation.
Thank you. Catherine?
Well, I think one of the things that that I hope is addressed is the inequality when it comes to access to wealth and finances. And if that's addressed, I think it would make a big difference. We have people now that are putting their lives on the line and could possibly lose their lives, but they still have student loans to pay back. You know, we have a lot of people that are in positions that are probably in housing that was inadequate in the first place, but they won't be able to pay their mortgage or pay their rent. And I think that we should learn from what happened with the last financial crisis to make sure that families are not suffering. And I agree that we have to make sure that the winners are the people that are in the households.
Thank you, Catherine. So we've come to the end of our session. So again, a huge thank you to Leilani Farha, Catherine Flowers, and Gregg Gonsalves for sharing your expertise and your insights with us today. And thank you to everyone who submitted questions. Apologies for those questions that we weren't able to get to. And the recording, including closed captioning of today's event, will be available. So you can check the series website for that. And our next event is tomorrow at the same time, 12:10 Eastern Time. And the topic will be upholding digital and information rights during the pandemic. So we hope to see many of you again tomorrow. Thank you again very much.
Thank you.